Good afternoon, everyone. Thank you for joining us today. My name is Molly Alawade, and I'm the Director of Education here at the American Kidney Fund. Before I turn the presentation over to today's speaker, I'd like to direct your attention to the control panel you should see on your screen. All participants are on mute, so we won't hear you, but we welcome your questions. If you have a question, please type it into the section of your control panel titled Questions. We'll see your questions and we'll do our best to answer them, either by replying to you in the questions box or out loud during the last several minutes of the presentation. For those of you in attendance who are health professionals, we are glad that you joined us today and hope you'll recommend this webinar to the patients you work with. However, as a friendly reminder, this webinar is not accredited for continuing education credits. If you believe that your accrediting body may offer you credits for attending this webinar, we'll be happy to send you a certificate of attendance after today's session. Simply email us at education@kidneyfund.org. Without further ado, allow me to introduce today's speaker, Kathy Merritt. Kathy holds her master's degree in social work from West Virginia School of Social Work. She has over 30 years of clinical experience working in the outpatient hemodialysis setting. Kathy has worked for Satellite Healthcare for 19 years and is currently the Social Work Services Manager for the company. She helps train new social workers, is a subject matter expert for the Center's social workers, and regularly presents at Satellite's new employee orientation on boundaries and professionalism and dealing with challenging patients. She also has presented at the Western Board of Nephrology Examiners Nursing Technology Seminar. Among her many accomplishments, Kathy is the past co-chair of the Council of Nephrology Social Workers of Northern California. Thank you, Kathy, for joining us.
Thank you for that introduction. It's an honor to be here.
Wonderful. So we'll get started with questions on the role of a social worker. So our first question is, please describe 5 ways a social worker can assist a kidney patient.
Sure. There are many ways that social workers can help assist kidney patients. One of them being that we can assess and kind of coach patients that are starting on dialysis or are on dialysis towards being physically, emotionally, and social balanced. You know, when people start on dialysis, there's a lifestyle change that happens, and then there's an adjustment period that we can help the patients go through. We advocate for patients' needs both in the centers and in the communities, and even at state and national levels. Many of our social workers enjoy the grassroots advocating for better quality care for our patients. We can refer to community agencies. We also assist with assessing and discussing quality of life issues and things that are important for the patient. So if they have a goal that they would like to work towards, the social workers may be that person that can help navigate through the system, working with the interdisciplinary team to get their needs met.
Wonderful. Thanks for that explanation. So our next question on the role of a social worker is, does a clinical social worker only become involved after a patient starts dialysis? And if so, why not before?
Sometimes you may have exposure to a social worker before you start in dialysis. Some of that may be if the physician refers you for options training about what options are available for treatment options. So sometimes social workers will do that. You may have exposure to a social worker in a hospital setting as they're setting you up to help you with starting on dialysis, or if you're on dialysis and have been in the hospital, that you will have follow-up with that. Some of it is there's some regulations around what we can do before patients become our actual patients, and that's why there's some limited availability of social workers beforehand.
Great, that makes sense. So another question we received was, if you do home dialysis, do you still get social worker services?
Yes. If you do home dialysis or if you do in-center, you get the same social work services. Social workers are actually, as many of the members of the interdisciplinary team in dialysis settings are mandated by our conditions of coverage, and those are the rules that the Center for Medicare and Medi-Cal Services say that we have to provide in order to be a Medicare provider. So, yes, home dialysis patients will also see a social worker just like they do in the in-center.
Wonderful, that's good to know. So our next question is it possible to have more than one social worker?
Yes, you'd only have really one dialysis social worker, but if you've been referred for a kidney transplant, you would be assigned to a transplant social worker where their expertise is all about the transplant process. You may also be, if you have home health agency, you might have a social worker through that. You might have a social worker through your insurance company. Some insurance companies work with high-risk clients and will assign them a social worker to help them navigate through the system as well. Other agencies, if you're in a rehab services or in a skilled nursing facility, you'd also be assigned to a social worker in those settings. And often, as a dialysis social worker, and I know that you're involved with these other agencies, I would try to collaborate with the other agencies so that we're all working towards the same goals. Of course, we'd have to have your permission to have those conversations. We want to make sure that we handle confidentiality appropriately, but that is something that we sometimes will do to try to work together.
Thanks for that response. So our next question is, if I don't find my social worker helpful, can I switch those social workers? How?
Yeah, that's a challenging scenario, and the fact that it depends on your center or facility where you dialyze. Some facilities may have more than one social worker, so there could be an easy way of asking to be switched. But many centers, the way that they're staffed, may not have the ability to assign somebody else to your case. And if that's the case, what I would suggest is that you talk to the facility or center manager about your concerns so that they can try to address that. Or maybe even just having a conversation with the social worker themselves about what your expectations are, and so that we could all be on the same page. So it would really depend on the facility that you're dialyzing at, if there's an availability to be able to do that.
That makes sense. All right, and so our last question in this section on the role of a social worker is, what is the role of the social worker with family and caregivers?
So when people are on dialysis, dialysis just doesn't affect the patient, it also affects the entire family and the caregivers. And so as a social worker, I try to be very supportive to the family as well, to help them sort of navigate through some of their feelings and emotions that they're dealing with now that their loved one is on dialysis. Of course, we try to, if we're having, there's specific questions around the patient, we want to make sure the patient's given us permission to have those specific questions. But if there's sort of general kind of questions where maybe the husband that's on dialysis and the wife is really just struggling with what that means for her, then I could definitely have some counseling time just to give her that opportunity to have a safe place to talk about those feelings and emotions. So sort of there for the whole unit, as much as they want to be involved.
All right, that's a great explanation. So now we're going to transition into questions about financial support for kidney disease. So our first question in this section is, Do I qualify for Medicare because of ESRD?
So yes, ESRD does qualify you for Medicare, but you also have had to have paid into the Medicare system in order to be eligible. So you've had to have worked enough quarters. Or if you haven't worked enough quarters, your partner or your spouse has worked the quarters so that you can draw off of their record. So most patients will be eligible, but there may be a few patients, if they've never worked, may not be eligible for Medicare benefits.
Alrighty.
And the resources that they have out there are also great resources to get more detailed information about the number of work quarters and those questions.
Great. And so our next question, sort of following in that same stream of thought, do hospitals accept Medicare insurance?
Yes. I have never run across a hospital that has not accepted Medicare. There might be physicians that may not accept Medicare patients, but hospitals do.
Wonderful. So our next question is, what are some financial assistance programs that are specifically for kidney patients?
Mm-hmm. And this is a great question, and one that I know that finances is often a big concern for our patients. So the American Kidney Fund actually has their safety net program and their premium assistance program that is for kidney patients. Some pharmaceutical companies have prescription coverage help. They may have discount cards for their insurances to decrease co-payments. There are about 15 states, because I know this is a nationwide webinar. There's about 15 states that have kidney programs that are state funded. And each of those programs are a little bit different depending on the state. Some help with transportation costs. Some may be about helping with medications or treatment coverage for a certain amount of time. So you would really have to, speak with your social worker in your center to see if your state, if they have that program available in your state. And I also know some local communities may have kidney-specific programs. In the area where I work, we have a group of staff members that a number of years ago created a nonprofit agency, and they help people in that county. So there may be other areas where that happens. So you would just have to kind of reach out specifically in your area.
Great. Those are great tips and resources. So our next question is, how can I get help with my copay?
Another great question. So I would say that you would need to check in with your facility or the company where you dialyze to see if they have any financial assistance programs that may be able to help you with the copay issue. Sometimes insurances may also have a program, so it's not, there would be another source of asking your insurance company if they have a program that might be able to assist with that because you're financially having concerns. And if it's not dialysis related, even hospitals will sometimes have programs as well that can help if you have a large copay from a hospital bill. Lots of times the agencies don't advertise about these programs, but if you ask about them, they may be available. So I always say, if you're not sure, it doesn't hurt to ask. The worst they can say is no, and the best they can say, yes, we have a program, and then this is how you would apply for it.
That's good to know. And our last question in the financial support section is, are there resources that provide kidney patients with academic and employment support, such as tuition assistance funds or work programs?
Sure. Social workers often work with vocational rehabilitation programs. All the states have them. Sometimes it's called vocational rehab. Sometimes it's called the Department of Rehab. But they all help patients with assessing their career goals. And then if they need to return to school or need further training, they can help with that and the cost. They come up with a plan of getting you back into the workforce, and whatever that may look like, they would help with that. If it means that you need some assistive devices, they can sometimes help with those. If you have a more debilitating disability along with your end-stage renal disease, they might be able to help out with those services as well. And the Social Security also has a Ticket to Work program that also helps provide career counseling and job placement. And they can also help educate on, there are programs within the Social Security that you can still do a work trial so you don't lose your disability benefits. And so the Ticket to Work program and the website that we have up there would be a great place to find out more specific information about how that works and the services that they can help provide in regards to helping people get to some of their lifetime goals.
Thanks for sharing those resources. So now we're going to move on to the next section of the webinar, and these questions will focus on emotional support for you or your loved one with kidney disease. So our first question here is, can dialysis and transplant be difficult on a marriage, and how can couples protect their marriage during this challenging time?
Yeah. Yes. Dialysis and transplant can be difficult on a marriage. It's a lifestyle change that impacts not only the patient but the family and the marriage. I would say that having good communication with your within your marriage is very helpful, and don't try to hide your feelings or keep secrets. Be willing, and also be kind of willing to help hear what's happening with your partner that's going through the dialysis, because I think that just helps with when we know what's going on, then we can be more supportive in those scenarios. If you've gone through other challenging times in a marriage, think about those times and what it took for you to get through those things. Was it being supportive of each other? Is it reaching out to community resources? Maybe it's needing a little bit of counseling to help get through whatever area that you might be stuck in. Maybe it's reaching out to your faith community if that's an important part of your life for that, just to think about some of these things. And sometimes it's about just taking one day at a time, being supportive. I always try to encourage people to let the patient that's on dialysis still do the things that they can do. Often when we feel that, and this is for most caregivers as well, I think, we feel that the patient, now that they're sick, they can't do anything, and we keep doing and doing and doing for them, and it takes away some of their dignity and independence, and yet they can still do that. So sometimes it's finding that balance of what they can do and letting them do that, and then still being supportive and helping them when there's things that they can't do. And sometimes we just have to work on changing ourselves. We can't always change our partner. And so being aware of that, having talks about, your expectations. Maybe this is happening at a time in your life when you thought, I'm retired now, we're going to travel and do all these things, but now we can't do that because of dialysis. So having some conversations about what that makes you feel like and being supportive of each other through that process, I think, are ways that can help protect marriages.
That's great advice. So our next question is, I did not want to admit that I had kidney disease to myself or to others. Is that an expected reaction? And how can a social worker assist with these feelings?
Yes, that is a very, very expected reaction. I see it all of the time and kind of label it as sort of being in denial of that there's anything going on. And it's a way that we cope with change sometimes, that we just kind of deny it and kind of push our way through. But at some point, if we don't come to accept that we're on dialysis or we need to be on dialysis, there becomes a real struggle. And it can be not a healthy way of dealing with the diagnosis. So as a social worker, we can help you assist with these feelings by listening to your concerns and emotions and maybe thinking of ways to get you more support in dealing with some of those things that you may be feeling about. Sometimes it's about, you may be anxious about the future, and we can talk about, you know, planning and small steps that can help make things a little bit less anxious for you. Or maybe it's about, you know, doing mindfulness techniques or deep breathing exercises that we can help sort of decrease some of that anxiety for you. Or maybe there's just the anger that you have to be on dialysis, or you're feeling guilty because you didn't take care of yourself now, and now you're here on dialysis, and some of the shame that goes with that. These are all things that social workers are very used to hearing. We're non-judgmental about that. In fact, when you share those kinds of things, that's when we can really step in and do the best things that we do as social workers to help you navigate through that, so you don't feel like you're alone in having to deal with some of those feelings and emotions.
That's so good to know. So our next question on emotional support is, how can the renal care team and caregivers help patients with mental health issues who are not following their treatment plan or going to healthcare appointments?
Yeah, this is something that we see quite frequently, especially when there are mental health issues that are either identified or not identified that are going on. As social workers, well, and as a team, we try to encourage follow-up. We will assess to make sure there's no real barriers to what needs to happen. And are they able to get to treatment? So we will check to make sure they have transportation. Is there any insurance issues? Is there problems with them getting the medications that they need that help regulate them? We would try and help with those resources as well, to sort of make sure that there's no barrier for them not to go to treatment or following through with things. If a patient is identified and is part of the mental health system, I often will reach out to if they have an assigned provider or a social worker, with the permission of the patient, talk to the provider so that we can both be working towards the same goal, so that they're not saying one thing and we're saying something else, and then that really confuses the patient even more. Sometimes patients that come in may not have been diagnosed, but when we sit and talk with them, we really realize that there is an issue of depression or a schizophrenia that's going on that's sort of been undiagnosed, and so then we would help try to make the referral to mental health and get them into the mental health system to help meet their needs. But it is an overall really challenging situation because everybody has the right to self-determine, meaning that they are competent adults to make their decisions unless they have been deemed by a court of law that they can't make their decisions, so they maybe have been conserved or in guardianship. That doesn't happen very often. So many times the best thing that we can do is educate, support, make sure that we've addressed any barriers or issues that might be blocking them from following through with what needs to be followed through, to provide support and help them make better choices, but they still have the right to make the choices, if they be good choices or bad choices.
That's very well put. So now we're going to get into our next section on other resources for kidney disease patients and caregivers. So what resources are available for caregivers?
So there's the website that we put up here, the National Alliance for Caregivers, is a great resource. It has a listing of resources broken out by state and communities. There are support groups for caregivers. Sometimes some of our centers will sometimes do a support group, and we may do patient support groups, and we may do caregiver support groups, because we realize there's a lot of stress that comes with being a caregiver, if you're doing in-center or if you're doing home therapy. Sometimes that adds a different dimension with the home therapies, because you really have a lot, sometimes more responsibility, it feels like, in those scenarios, and can be stressful. So reaching out to agencies like this, to the social worker who can maybe put you in contact with a local agency. If there's other diagnoses going on, there are, like an Alzheimer's diagnosis. The Alzheimer's Association has lots of great resources for caregivers and how to help manage some of the issues that arise with patients that have Alzheimer's or a dementia diagnosis as well.
That's a great list of resources. Our next question is, where can I find out about assistance for funeral arrangements?
So there are some state and local burial assistance programs depending on your state and your locale. The Social Security Administration also has a death benefit that's available for people on Social Security. I think it's an amount of $250. And then if the patient is associated with the VA, there might be some benefits available for them as well. When I was doing my research, they're looking at for non-service connected death, their benefit's about $300, and if it's a military related death, they could get up to $2,000. So it's you have to, it's driven by receipts, so you return in the receipt and get reimbursed for that money. It's not just we'll give you the money kind of benefit. But if they're VA, then I would check in with the VA about those types of benefits. Some areas and some of the resources, dialing the number 211 or putting that into Google will also bring you up local community agencies that have assistance. Reaching out to funeral homes or mortuaries in your area they also will be a resource of what is available in your specific community.
Well, that's very good to know. So that brings us to the end of the questions that were submitted ahead of the webinar, but now we're going to transition to some of the questions that our audience has submitted throughout the course of the webinar today. So our first question here is, I hear a lot about social workers being heavily involved in investigating insurance coverage and getting approval for patients. Can we talk about this process and the social worker's role?
Sure. It depends on, that's on company-wide things, and not all social workers are doing that. For example, the company that I happen to work for, we have a patient services department that sort of takes over that piece of the role for us. But I know before we had patient services, we did often spend time calling the insurance company, verifying the benefits. If there needed to be a referral, then we would make sure the physician filled out the referral form so that would go to the insurance company to get processed as well. And that can take time. If you're having to call an insurance company, if any of you on the line have called your insurance company, sometimes we have to be on the line for 30 minutes or more. Like you, we don't always have the magic number to get us through to somebody else too, so that can take some time to do some of that investigative work.
All right, that's good to know. So our next question is, what has been your experience in establishing and maintaining a patient support group?
So we've had successful support groups. What's helpful is having a core group of people that have an interest in doing the support group. Now, there's two types of support groups that you can do, and the one that I did that we lasted for 5 or 6 years, we kind of alternated it. We met once a month. 1 month we would have education, so I would bring in somebody to talk to them about the dialysis machine, or so I would bring in one of the techs to talk about the machine, or we'd have the dietitian come in and talk about diet, or we had the doctor come in, or we would talk about somebody that came in from hospice and talked about their services and or advanced directives, those kinds of things. And then the other months we would meet, we would just sit and talk about what was going on in our lives. We also had a rule that it couldn't be, because we were open to many different centers, so we really tried to keep the center issues out of the conversation, and it was more about, the day-to-day life of what was going on and how we could be supportive to them and sharing resources, those things. Once our core group of people started to dwindle, we had a harder time getting the group to stay, to continue to function, and I couldn't get another core group of people, so sort of it ran its course. And I think a year or two, maybe 6 months later, another social worker had another core group of people, and that she was able to work with that. And the core group can be just 2 or 3 people, and having them talk to their peers about the help that it was for them through that process, I think is very helpful as well. I know in some of our home therapy programs, those patients really look for some connectivity, and so we've got several centers where it's been really successful for a number of years of having that support group, and it more is about connectivity and building community for the home therapy patients. In centers have a sense of community where that doesn't always happen on the home therapy side, because you're home and you come in once a month to see the team. So
thank you for that explanation. So another question we received is, does having kidney disease qualify me for disability benefits? Yes,
it is one of the factors. You still have to have there's still, the physician would have to sign off on that as well for disability, but it is one of the diagnoses that makes you eligible for disability.
Okay, that's good to know. So somebody else asked, what happens if I can't pay all my medical bills? Do I incur medical debt? And who pays the debt when I pass away?
That is a really good question, and I really am not comfortable in answering that question without doing some more research on that. So I think that would be one that we would definitely get back to you about, because I'm not 100% sure. I don't want to speak about something I'm not 100% sure about.
Absolutely, and we can certainly do some research and follow up with that question asker. So our next question is, I don't have transportation to get me to dialysis. Who can help me with that?
The social worker should be able to help you with providing a list of the resources that are available in your community, because that definitely would be something that we could do in helping you set something up depending on where you're at in your community. But the social worker would definitely have access to resources regarding that.
Great explanation. So somebody else asked, do you also communicate with pharmaceutical-sponsored patient assistance programs, or is that mainly a patient's responsibility?
So as social workers, we try to really help patients that are able to navigate through some of the systems to be able to do that. So we do connect with the pharmaceuticals, but if a patient is willing and wanting to have some of that contact, we might have you do that as well. We're all about empowering our patients, and I always sort of come from this perspective. I might not always be around, so let me help you with the tools so that you can make some of the calls. But if it's a challenging thing, then we may sometimes do things together. But definitely we can do that, but we may ask for some of your involvement in that process as well.
Great. So our next question is, aside from Medicare, what are other federal programs that can help kidney patients?
So if we're talking about from an insurance perspective, there would be, in California it's called Medi-Cal, and the rest of the country it's Medicaid. It's an income-based program that helps people with insurance coverage issues. The exchanges are kind of help with secondary insurance coverages for that. So I'm not sure if you were looking from an insurance perspective or if there was something else that you were thinking about when you talk about the federal government.
I think the person's just asking for any federal programs they might be eligible for.
Yeah. Depending on the situation, there are other things like housing assistance that you may be eligible for. You may be eligible for sort of Meals on Wheels. There are many different agencies that may be available depending on the actual need. And so knowing what the actual need is would be a little bit more helpful in being able to maybe be a bit more specific in answering that question.
Well, I think you've definitely given us a couple of programs to check out here, so that's great. So our next question is, can my social worker help me apply for grants?
To apply for grants? I would think it would depend on what the request is and what kind of grant. I've had some social workers that the patients have been applying for a grant that required this sort of, yes, that they're on dialysis and maybe who they are as a person, and character kind of grants. And we can help with that as long as we have signed HIPAA compliance forms. So we want to make sure that we have those in place so that we cover ourselves with that. Sometimes we get asked to write letters that may be more appropriate coming from the physician, and so we may work with the physician to maybe gather that information up for that as well. But I think if it's asking us to help with being a character or that you're on dialysis, that's definitely something we can do. If it's actually filling out the paperwork, it depends on what the availability of the social worker and what's required around that.
That makes sense. Our next question is, what should I do if my social worker is unwilling to assist me?
Good question. I would suggest having a conversation with them about the expectations and talking to the center or the facility manager, whoever that might be, where you're dialyzing, so that maybe you have a sit-down meeting to have a conversation about what's going on and what the expectations are.
Well, that sounds like a plan. So our next question is, where do I get help paying for supplemental insurance?
So if you're eligible, you could apply for to the American Kidney Fund for help with the premiums for supplemental insurance. There's an application that needs to be filled out, and your social worker can help walk you through that process.
Great answer. Our next question is, can a social worker help me with job placement?
They may not be able to help you exactly with the job placement, but they can refer you to like the Department of Rehab or vocational rehab or the Ticket to Work program, who then can help you with the job placement, because that's really their area of specialty. And so, you know, social workers, our area of specialty is about dealing with the dialysis and not so much about job placement, but we can get you to an agency that is their specialty that can help give you better guidance around that, because that's what they do day in and day out. So
great. And so our last question this afternoon is, what are some of the most out-of-the-box things you've been able to assist a kidney patient with?
Oh, that's a good question. I once had a patient, this really wasn't out of the box, but it was sort of extraordinary in the fact that he was, his village during World War II had been displaced in Germany, and somebody had sort of created a group to get a reunion of this village, and he really wanted to be able to go back to his roots and be a part of that. So we worked with getting him his dialysis. He was doing in-center dialysis at the time, and so we worked with an agent, a hospital there in Germany, and got him his dialysis, which was really a challenge because none of our staff spoke German and everything came to us in German. So we had to be creative in using the family to help us translate those things. But the fact that he got to go back and be part of the reunion with his village was huge for him, and it was sort of a lifetime achievement that he had. The one thing that I can think of right off the top of my head.
Wow, that's an incredible story. Thank you for sharing that. Now, I know I said that question was the last question, but actually someone just snuck one in, right at the last second. So our very last question is, how do social workers help homeless patients to find housing? And is there any assistance programs for groceries and food?
Okay, so the last part of the question I didn't catch. I heard about the homelessness and housing, but what was the
last part was about groceries and food. Are there any assistance programs to help with that?
So there are, many communities have food pantries and food banks that the social worker sometimes works with the dietitian in order to know where some of those places may be to help out with food. As far as like for homeless people, we do work closely with shelters, knowing of shelters and trying to help our patients understand that process and work through that, and getting them into that. And some of the shelters also have social workers within the shelter that will help with getting individuals connected into a more permanent type of housing. There's even a few shelters that have a more medical base to them, so that so if we know that, we try to get our patients sometimes into the medical-based shelters so that there's a person there that can help manage their medications and help with that process as well. So that's something that we as social workers would look into our communities, see what's available, try to network and build those relationships so that we have that resource that we can use with our patients.
Well, thank you for that answer. And thank you just so much, Kathy. So that was our last question. So this concludes today's webinar. This webinar was recorded and will be made available for viewing on our website, kidneyfund.org/webinars, within the next 1 to 2 weeks. Our next webinar will be about food safety and kidney disease. The webinar will be held on Friday, November 15th, and hosted by Crystal Oconta from the USDA Food Safety and Inspection Service. Registration is now open. Visit kidneyfund.org/webinars for more information and to register. When the webinar closes, please do not close your browser window. You may see a pop-up saying that the webinar has ended. Please close that pop-up and proceed to the webinar evaluation survey. Your honest feedback will help us make our webinar program the best it can be. Thank you for joining, and we hope to see you again.